everyone, I am Dr. Prateek Varshney. I am Director of Surgical Oncology at Fortis Hospital, Shalimar Bagh. On 31st May, all over the world, we celebrate it as World No Tobacco Day. On this occasion, we are here to answer few of the common questionnaires asked about tobacco-associated diseases and cancers. There are a lot of tobacco-associated diseases. The more common ones are stroke. So there are a lot of tobacco-associated diseases. The main diseases are stroke, myocardial infarction, commonly known as heart attack, and cancers. There are a lot of cancers which are associated with tobacco. Most common among these are oral cancers, जिन्हें हम normally भाषा में मुंह का कैंसर कहते हैं, cancer of larynx and lung. These cancers are very common in Indian population and majority are associated with tobacco intake in any form, be it smoking, pan, bidi or khani. Yes, that's the main interesting part about these cancers, that majority of these cancers can be prevented only if we don't take these addictions in form of tobacco and alcohol. So around 50% of cancers of India can be totally prevented if we stop tobacco intake. So if you ask me that whether all these oral cancers are caused by tobacco, so yes, majority are caused by these tobacco intake, but there are rare cancers which can be seen in patients who are not taking tobacco. So in such cases, a viral infection has been seen to be associated as a causative agent, that is a human papilloma virus. This virus is also associated with some other cancers like cervical cancer, and luckily we have a vaccine that is available in market which, when given at a proper age of 9 to 11 years, can totally prevent cervix cancer as well as oral cancers. So HPV vaccine is now recommended for both boys and girls at an age of 9 to 11 years. So oral cancers take a lot of time to develop from a pre-malignant condition to frank malignant condition, and that's the point at which we can detect these cancers and treat them at an early stage. So majority of oral cancers first develop in form of pre-malignant conditions like leukoplakia, erythroplakia, that is a whitish or reddish patches in our oral cavity. And in some other cases, it can be a mild hoarseness of voice or some difficulty in swallowing. Some patients might find a swelling in their neck, commonly known as lymph node. So these are early signs of cancer, and if we can detect these cancers at such a stage, we can treat them with good functional and cosmetic results. So everybody should be aware about these symptoms. If they are taking tobacco, they should be aware that they should have a look on their oral cavity and neck, and if these symptoms are present, please consult your doctor. So to summarize on this World No Tobacco Day, I would like to give a message that we should spread awareness to each and every individual that we should avoid tobacco intake and alcohol intake. We should make our next generation aware about the side effects of tobacco intake so they don't indulge in these addictions and can save our next generation going into the hands of cancer. We should pledge that we should not take tobacco and also not let our next generation to take tobacco and alcohol. So in India, majority of oral cancers are found in male individuals, but the incidence of oral cancers and head and neck cancers are also increasing in women. The very common question asked that majority of females in India don't take tobacco or alcohol, so why the incidence of oral cancers is increasing in women? So again, the answer lies in etiology. There are many other factors like environmental factors in which they are living, and the most important factor is a viral infection, that is human papillomavirus infection. So this virus is found to be a causative agent in majority of women in India who are having oral cancers and they don't have any history of tobacco intake.